Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast. What's up, Everything Medicare Podcast Nation? Welcome to episode 130. Hope you had a great weekend. Hope your Thanksgiving was fantastic. And every single Monday, I bring you three podcasts. Not every single Monday, every single week, I bring you three podcasts where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. And this episode almost did not happen, folks. But we make a commitment to making sure that we're bringing you three episodes every single week about Medicare, and by golly, I intend to stick to that schedule for you, my lovely audience. Now, over the weekend, folks, I had a trying time. So I told you a little bit about what was going on with my daughter. Okay. What was going on with my daughter was basically she had a horrible rash. Long story short, we ended up taking her to the ER. It ended up being nothing, but we got some good advice and blah, 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 blah. I did an episode about that last week, a few episodes back, if you want to hear the whole story. So, over the weekend, I got the stomach flu. Lucky me, right? And now, the last week of December, which is basically the cutoff point to the Medicare open enrollment period, is the busiest time of the year for me in my office. For those of you who don't know, I own a company called Christian Brindle Insurance Services, where we help people with their Medicare of all different shapes and sizes in multiple different places. We're actually able to help people in 7 states pretty soon. 5 states officially, but we're working on adding 2 states as we speak. It's a process. It takes a little bit of time. But yes, over the weekend, I had a mild stomach flu, where I was, you name it, disgusting, okay, and feeling like crap. And I still feel a little crappy today, but I'm on antibiotics, I'm on medicine, I'm not going to infect anybody, and I'm 90% better than I was over the weekend. But it was trying, folks. It was trying. And then today has been incredibly chaotic because everybody wants to wait to the last minute to make a decision on their Medicare. Okay. So our phones have been ringing off the hook today. This is the one free moment we had to record this episode and bring you content. Okay. So today I wanted to do a really, really interesting episode for you. And that is about the Indian Health Service. The Indian Health Service, okay? So I'm going to dive deep into this. Now, I don't know as much about this as some people do, but I know quite a bit because I've done a ton of research and study. Believe it or not, I probably don't know as much about this as you'd think, but I've studied a lot, talked to a lot of people that I trust, and I feel confident to talk about it here today. For those of you who don't know, people that are Alaska Natives and Native Americans, okay, that basically qualify for these programs that are offered by the Indian Health Service, amongst other services, qualify for special health benefits that nobody else really gets, okay? And these people that are also seniors that also have Medicare, there's always kind of a discussion on, can they get Medicare? If they can get Medicare, can they get into Medicare Advantage plan? Can they get something to go with their Medicare? What is it best for the people that are the Native Americans and the Alaska Natives to do? Okay. Today we're going to talk about that. And folks, today's going to be a shorter episode than we normally do, primarily due to the fact that I'm still not feeling very good, and I hope you cut me some slack, because this is 130 episodes where I've delivered content for you every single time. And we're going to deliver content on this one too, just in a shorter fashion. We're probably not going to be a 20 to 30 minute episode. We're going to kind of keep it a little bit shorter. But this is an interesting, fascinating topic that I've been wanting to do a topic about for some time. Now, don't forget, before I get into this, this is the last week of Medicare Open Enrollment in 2019. As I talked to you today. It is December 2nd. Okay, December 2nd, meaning that Saturday, which will be December 7th, is the last day that you can make a change on your plan, whether you're on a Medicare Advantage plan and want to change to another one, or whether you're on a Medicare Advantage plan and want to go to original Medicare with a supplement and a drug plan, or if you want to go from a supplement and a drug plan to a Medicare Advantage. This is the time period that you can do it. There is no turning back. God help you. Hold your peace. Whatever. After December 7th. So please do not call our offices December 8th wanting to change unless you have some kind of special situation. Okay. I'm going to take a quick break. I'm not going to get into too much fluff on this episode, but in segment 2, I will be back and we will discuss the Indian Health Service, what it is, what it has to do with you, and how these people can get Medicare. Stay tuned. Don't go anywhere.
What's up, everybody? This is actually Randy W. Hall, Mr. Nice Guy Medicare Advisor, not Christian Brindle, your esteemed host. I'm here to tell you about my Medicare agency, Mr. Nice Guy Medicare Advisor, based here in Tennessee. For the past 10 years, I've been helping Medicare beneficiaries just like you in Tennessee and Kentucky maximize their Medicare. If you're a regular listener of this podcast, you know Christian always encourages you to deal with a broker in your state who sells all the different plans and will give you not just a quote, but also advise you and educate you in a way that is simple to understand. We know how confusing and overwhelming the whole process can be. We do it all for folks on Medicare, from supplements to Advantage plans, Part D, cancer products, hospital indemnities, and more. So if you want to get a free quote or a consultation, I urge you to call 615-578-5174. Again, that's area code 615-578-5174. Or for more information, you can visit my website and read all about me at MrNiceGuyMedicareAdvisor.com. That's all one word, MrNiceGuyMedicareAdvisor.com. And again, why deal with a jerk when you can deal with a nice guy?
Welcome back, everybody. Thank you so much for sticking with me through that quick break and hearing from our sponsors just for a moment. So let's jump right into this, okay? Indian Health Service also stands for IHS for short. You can find a lot of this good information on ihs.gov. What the Indian Health Service is, folks, and I'm going to borrow a little bit of research here just so I don't get dates wrong and figures and things like that. But basically, years ago, now this dates back to before any of us were born, but years and years ago, our country made a deal with a lot of Native American tribes, okay? And what this deal was is they would give up land, essentially, to the Americans. I know this is a super controversial topic, but this is just a fact. This is what happened, okay? I'm not saying it's good, bad, indifferent. I'm not talking about that, okay? But they made agreements that they would provide certain things and benefits to these Native American people as in an exchange for the land, okay? And that has evolved into the IHS, the Indian Health Service. Now, they do a lot of different things, but mainly what we're talking about today is the health care that they provide. So it works something like this. If a person is part of the Indian Health Service, or they qualify for it, they're able to get seen at certain facilities around the country. Now, these facilities work kind of similarly to a VA facility or a VA hospital, but it's a little bit of a different thing. And they're able to see a Native American Indian health provider. Okay? And these Indian health providers typically can provide services for the Native American people. Okay? And typically it doesn't cost them anything to have this service, and it typically doesn't cost them little to anything to get this service done, but there's limitations on what they can get done there in these facilities. Okay? So that's why IHS encourages these people to get Medicare if they qualify, or to get insurance if they qualify. Now, there's a lot of people in this situation that also qualify for Medicaid. Okay? So the reason why they encourage these people to get insurance is this. The funding is probably not what they'd like it to be at the IHS, and the amount of things that they can actually do in these facilities is limited, to say the least. They can do a lot of things, but there's also a lot of things that they cannot do, and they're limited on what they can do. So insurance gives them a place that they can bill and get additional funding to help pay for additional things. Pretty simple, right? So how does this work for somebody that has Medicare? Well, if you're a senior and you're Native American and you turn 65, you get Medicare, right? You get Medicare Part A and Medicare Part B. If you qualify for Medicaid, you can pick up Medicaid as well. Medicaid will pay any of your Part B premiums for you, and you can continue to see your Indian health provider. The Indian health providers and the facilities can then bill Medicare, and they were able to treat you for a more wide variety of things than they probably normally would have. This is very important because it's vitally important, folks, that you're getting the best health care that you need. I understand that, free is good and free is nice. Jackass outside, car going off. I'm not going to edit that out. We're going to keep going. It's vitally important that... lost my train of thought. It's vitally important, folks, that everybody gets the health care that they need, and the Native American people have just different needs than that are unique to them. So can you get a Medicare Advantage plan in this particular situation? Well, in some cases, yes. There are certain Medicare Advantage plans that the Indian health providers can bill. You just need to make sure that you check with your Indian healthcare provider ahead of time to make sure. But if they can take a certain Medicare Advantage plan that you're eyeing, if you're in this situation, if you're Native American, then I encourage you to pick up a Medicare Advantage plan because you get an array of extra benefits that you wouldn't get normally. Indian Health Service isn't an insurance. It's a service that you qualify for. Okay? Now, granted, the other reason why you want this coverage, the other reason why you want Medicare is quite simple. It's so you have the option of going to other facilities if you want to. It's so you have the option of going to private hospitals if you want to, because let's be honest, folks, most things, now this isn't the case all the time, so don't crucify me for saying this, but most facilities that are completely healthcare related, whether it be VA facilities, whether it be the Indian Health Reserve, has a reputation of not having the greatest quality of coverage. Healthcare. They just don't. They don't typically have the reputation of being able to treat you as well as a private hospital would. Now, not all of you would agree with me on that, but that's just the reputation. I'm not saying that's fact or necessarily the case everywhere, but that is the conceived notion of the public. So, it's nice to have the option to go to a private hospital if you so choose to. So having Medicare gives you that option. Now, if you have Medicare only and you don't have the Advantage plan or anything else to go with it, I don't think you necessarily need anything more than an Advantage plan if you qualify for the IHS. But if you just had Medicare alone, and let's say you didn't qualify for Medicaid, you're in a situation where if you do go to a private hospital, if you do go outside of the IHS facilities, your Medicare will then charge you high deductibles. They'll pay 80% and leave you behind with 20%. The Advantage plan will lower your out-of-pocket to where you'll pay a simple copay for the service. It's good to have that protection just in case you want to have that option. Okay? It's important that people that qualify for the IHS don't just reject Medicare. You want to take Medicare. And if you can't afford the Medicare Part B premiums, get on Medicaid. Medicaid can help pay for it as well. The IHS encourages it. The government encourages it. CMS, the Center for Medicare and Medicaid, encourages it, folks. And we'd be happy to help you if you live in one of those states if you live in one of our states, okay? Our states are very, very simple. Utah, Idaho, Oregon, Texas, Florida, and soon to be South Carolina and Colorado. Very, very close on those two. Again, that's Utah, Oregon, Idaho, Texas, Florida, and soon to be South Carolina and Colorado. Don't go anywhere, folks. I'll be right back in our third and final segment after we take a quick break. I'm sorry for my low energy. I'm just still a little bit under the weather, and we've just been overwhelmed by phone calls today. But I had an obligation to make sure that we brought you a podcast episode today on Monday. On Wednesday, I should be back to my regular self, but had to bring you some kind of content on a Monday, and this is kind of an interesting topic if you ask me. Don't go anywhere. I'll be right back. Have some final thoughts. Welcome back, everybody. My closing thoughts on this topic are very simple. If you're a Native American, or if you qualify for the IHS, I still encourage you to pick up Medicare, and so does the IHS. Go ask them yourself. It's important that you have options, and it's important that they can cover you for a more wider diversity of things than you can get just by using the IHS facilities on its own. Okay? Your health determines that you can be covered for a variety of different things that could potentially happen to you. Not saying that we're wishing that, knock on wood, but you need to be protected. And I encourage you, if there's any Native Americans that listen to this or hear this podcast episode. Okay? As always, folks, this is the last week of the Medicare enrollment period. If you'd like to work with me, give us a call. This is the last week you can do it. I mentioned in the last segment the states we can work with you in. 801-255-5340, 801-255-5340, and we will work with every single person that we get time to work with. Okay? Thank you so much for listening. Thank you for being patient with me while I'm under the weather and dealing with this. We'll be back with our regularly scheduled program on Wednesday. Have a great day. Don't go anywhere. And stick with us till Wednesday. Okay? Don't stop listening. Thank you for your support. Have a great day.